Germany's COVID crisis keeps escalating. The number of daily infections has risen above the 30,000 mark for the first time. That's just days after a record spike in the German death toll, which has been lagging the infection numbers by several weeks. The country's second wave is also threatening to swamp the country's medical system. In the worst hit areas, hospitals have begun to transfer patients to less severely affected places.
A new COVID patient has arrived by air ambulance at Freiburg's University Hospital. He's travelling in a special isolation pod, so none of the transport team gets infected. The patient is only in his 40s. He's transferred to Viviane Zotzmann's intensive care unit. With 5 members of her team, she turns him onto his stomach. The prone position is an important therapy for seriously ill COVID patients. The team makes sure the patient is well padded, as he will lie like this for several hours.
The inflammation sits at the back of the lungs, and a lot of fluid collects there. The lungs can't heal if we lie on them the whole time. By turning patients onto their stomachs, their lungs get air and can heal.
Once a day, the team turns each patient onto their front and back again. It's a big effort. But proning and being put on a ventilator is not sufficient for many critically ill COVID patients. Some need to be connected to an artificial lung to keep them alive. It pumps the patient's blood into a machine where carbon dioxide is extracted and oxygen added. The blood is then pumped back into the patient's body.
For patients who are this ill, there aren't many options left. This is the last trump card we've got.
Our therapeutic options are sobering. We give oxygen and the artificial lung, but that only gives us more time. The lungs have to heal on their own.
In the hospital's pharmacy, there's no wonder drug against the coronavirus. Remdesivir, one of the great hopes at the start of the pandemic, has yielded disappointing results, as have many other drugs. Medics have fought the virus for nearly a year now, but the odds of surviving a severe case haven't improved much.
Every second person on a ventilator dies. Behind each of those numbers is a human being.
In the second wave, many young and healthy people have also been infected. But that's no guarantee for a milder course of the illness.
This is a young man, 45 years old, with a severe case of COVID. He's a prime example that a young, healthy person without any notable pre-existing medical conditions can be brought to the brink of death by this virus.
The intensive care units really are at the limit. We have to be clear about that. There might still be some spare beds, but every day there's fewer. And patients lie here for a long time, for weeks or even months, and that means beds don't free up quickly.
At the moment, they can still fight for every single patient's life here. But the time after Christmas could turn into the intensive care team's worst nightmare.
To talk more about this, we're joined by Hans Brandt, DW's political correspondent. Hans, welcome. Germany's infection rate is at its highest since the beginning of the pandemic. Walk us through how that is affecting the country's healthcare infrastructure.
Well, as we've just seen, the number of deaths is rising very rapidly at the moment, and in many hospitals in Germany, the limits are about to be reached or have been reached already. That's especially true for areas in eastern Germany and the far east of Germany, which at the moment have the highest infection rates in the country. These are rather remote areas where hospitals are small and their facilities are limited. In those areas, people are being moved out of those hospitals every day, normally by helicopter, to other parts of Germany where there are still beds available. All of this shifting around of patients is happening in many regions of Germany at the moment. So the health system is under strain. It's not overstrained yet, but at the same time one has to say overstrained are the people who are working in these hospitals. They've been working very hard. This is very often physically exhausting work, and many of them themselves are either infected or so exhausted that they can't work anymore.
are German lockdown measures not working, or why do we continue to see steadily increasing infections and deaths, Hans?
Well, we have to see that the infections that we are counting now are people that infected themselves maybe 10 days ago, and the deaths that we are seeing now are people that infected themselves maybe 3 weeks ago. So there is a lag involved in this, and we have to say that the measures that were in place 10 days or 3 weeks ago were not sufficient. They were not working. The more severe lockdown was only imposed this week. But there is some hope as a result of the vaccinations that are about to start with a vaccinating agent that was developed in Germany, about which Germany is very proud of. We have a report about this. Let's have a look at this report.
BioNTech began as a small startup back in 2008. Now the world's focus is on the vaccine developer in Mainz. One of its early backers, the German government, is pleased to be seeing a return on its investment.
I can say it myself, also as the head of the federal government. We are incredibly proud that we have researchers like this here in Germany.
Co-founder Ur Shaheen first read about the coronavirus outbreak in China in January and predicted a global pandemic. He decided to redirect their resources from researching cancer to finding a coronavirus vaccine.
It's a very exciting time. When we get the approval from the European authorities, we can start delivering our vaccine, potentially even this year. Our employees will work through Christmas to make sure that our vaccine makes it to all countries.
Initially, some 400,000 doses will be kept for use in Germany. If the EU gives the green light by the 23rd of December, vaccinations could get underway here by the 27th.
It's clear who will be receiving the vaccine first. Our primary goal is to protect people over 80 years old and those who live or work in retirement homes or care facilities.
The health minister says the rest of society will have to wait their turn for the vaccine.
Hans, media reports are that Spahn's vaccine rollout plan diverges from the Commission's recommendation. What do we know about that?
Yes, the health minister will be signing this regulation today, and he has confirmed that, in fact, whereas the experts had recommended 6 groups, 6 levels of patients that or people that should be vaccinated, he has regrouped this into 3 groups, and the reason for that is that he feels that is more flexible, so you don't have to just finish vaccinating everyone in the top group before you can go one step further down. So he feels that with this flexibility, the whole situation will be more easily managed in this situation. But the main priority still remains with people that are over 80 years old and with people that are involved in caring for sick patients, especially in hospitals.
DW political correspondent Hans Brandt, thank you very much. Meanwhile, the U.S. has moved closer to approving a second COVID-19 vaccine after an independent panel of experts endorsed the shot made by pharmaceutical company Moderna. The decision paves the way for the FDA to approve emergency use of the vaccine. The U.S. has already started its mass immunization with a COVID vaccine by BioNTech Pfizer. The EU, under pressure now to follow suit, said it too would speed up its approval of the Moderna vaccine. A decision's now expected on January 6th. French President Emmanuel Macron has tested positive for the coronavirus. The president's office says it's highly likely that Macron caught the virus at a European Council summit last week. His diagnosis fuels alarm and anxiety among Europe's leaders, many of whom had close contact with Macron at that summit. He also hosted Spain's and Portugal's leaders in Paris this week. Both are now in quarantine.
An affectionate squeeze. That's how French President Emmanuel Macron greeted officials and heads of government last week at the EU summit. And how he welcomed Portuguese Prime Minister Antonio Costa to the Élysée Palace on Wednesday. But now that Macron has tested positive for the coronavirus, those close contacts may wish they dodged his warm embrace. Last night, the president started to experience symptoms indicative of COVID-19. He immediately isolated and took a PCR test, the results of which confirmed that he is positive for COVID-19. As for everyone who tests positive in this country, contact tracing began immediately in order to identify the president's close contacts. Macron's symptoms are mild. He attended this meeting virtually from isolation. But the positive test has upended both his agenda and the agenda of European politics, as the UK and the EU attempt to negotiate a Brexit trade deal before the end of the year. A growing list of European leaders who met with Macron are now working from home. Working, that is, unless they become seriously ill. In Paris, there was little surprise at the president's misfortune. It's serious. It affects everyone. So no, there's no reason to blame him. It's obvious given his job that this would happen, so it doesn't surprise me. He probably didn't respect the social distancing rules. Macron joins a long list of world leaders who have caught the virus, and just over a week before the EU is hoping to begin vaccinations.
Let's take a look now at the latest global developments in the pandemic. China is planning to vaccinate 50 million high-risk people before the start of its Lunar New Year. At least 4 Chinese-made vaccines are in phase 3 testing. A study in Singapore suggests pregnant women with COVID-19 do not get more ill than the wider population. The study also found that babies born to infected mothers have antibodies against the virus. And officials in Australia have declared Sydney's northern beaches a coronavirus hotspot. 21 beaches will be closed because of a spike in cases there. Sydney residents are being urged to stay at home.